little joy to be found in the new numbers, 170 locally acquired cases, up to 105 of those infectious in the community.
We are expecting to see those numbers bounce around.
The New South Wales Chief Health Officer seizing on more crucial figures aimed at those still failing to take the outbreak seriously.
187 COVID cases admitted to hospital, with 58 people in intensive care, 24 of whom require ventilation.
And tragically, some people are seeking help too late.
Very sadly, we are seeing more families coming in with a family member who is presenting not alive but dead. That is a terrible situation.
With 3.8 million vaccinations administered across the state so far, the Premier is again urging people to help reach her lockdown-ending goal.
We had a target of 10 million jabs. We're over a third of the way there.
And she's made the cost of not obeying restrictions painstakingly clear.
You could be taking the disease home and passing it on to your parents, your brothers and sisters. Do not give those you love the most a death sentence.
But there's criticism over a decision to call the Defence Force in to help monitor compliance in migrant communities.
Extremely sensitive about those issues, but please know we've been working with the ADF for the last 2 years through the bushfires, through the floods. So this is just an extension of our compliance efforts.
Di Lee is a councillor for Fairfield in Sydney's West and joins us now. Di, your LGA is among those under the stricter lockdown. The Premier assures us that the ADF personnel are just being used to help enforce compliance. How's your community feeling about this?
First of all, the ADF has a role to play in times of crisis. When there are fires, when there are floodings, they come in to rescue the people, get them out of those crisis situations. But in our streets, if you walk our streets today, and I have just been out to Fairfield, the shops are closed. The city is almost ghost town. There's nobody there because everybody has complied to the restrictions that the government has placed on our community. There's a lot of memories for our community here who are a large proportion are refugees. Myself even. We've escaped war-torn countries. We've escaped authoritarian regimes. You know, I remember military personnel coming to our doors, knocking on our doors to save us, to take us out. Now, what are the ADFs going to do? Because they're not going to save us. They're not going to pull people out of our homes, but are they going to come and check on us? Are they going to stop us on the street and asking us to give us ID where we live if we've had ourselves tested? Can you imagine that being, put on a community that have just gone through the last few weeks of having to get out there tested, scared to death because, our streets have been cars have queued up out there to get tested because people are frightened. People are so frightened. Look, I want people to understand that we have done the best. The streets are empty. Oh my God, I'm feeling emotional here.
Because it is such an emotional topic. It is such an emotional topic, and it's very hard to, at a time like this, to understand why the messaging hasn't been clearer. But no one knows your community better than you. Is there a better way to engage them in a way that will improve compliance for those who aren't complying and to reduce the spread?
Can I say they have complied? More than half of our population have got themselves tested. The people that are coming into work in our city are not required to go through the stringent testing. How do we know they don't carry the virus in? The virus cannot be stopped through that invisible wall.
Di, we keep hearing from government officials that a communication barrier is causing migrant families to hesitate in getting the vaccine or going to hospital when they have those symptoms. Is that what you're seeing happening?
There is definitely a vaccine hesitancy, definitely, because I think the government has not communicated in terms of give people the understanding that the vaccine has not just been around for the last 12 months, but it's been around for 10 years in research, for instance.
So what would fix that?
Well, I think there has to be a national campaign, not just multicultural community, mind you. We saw the protests. We saw people who are hesitant about vaccination. So we need to educate the community about the vaccines. People just think that the vaccine just emerged in the last 12 months. Well, there is a history. But in addition, we need to provide the vaccines. Now, the vaccines are not even available So how can you get people to get vaccinated if they're not available?
Thanks so much for your time, Di. We appreciate it.
Thanks, Peter.
We've all been looking at these infectious while in the community numbers and getting really nervous about what that means. And there's a presumption that it's people not complying that is driving that number up. But I can just say anecdotally, I've got a relative who was at a bakery last Sunday. He was only contacted yesterday that he had been at a place where somebody had tested positive. So he had 4 days in the community where he could have had COVID.
And if he's non-symptomatic,
well,
how would he know?
Well, he's tested negative and he's had a double shot, but he's isolating. But there's an indicator of somebody who was in the community for 4 days, which means either the contact tracers are being overwhelmed, but there's all the other variables like people who are asymptomatic, who aren't presenting. So, you know,
it's a lot more complicated than it
It's not just people not complying.
Don't just assume people are doing the wrong thing. Yeah.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.